Rose was 76 when she walked into her Dr. A.'s office for a routine test she thought would keep her safe. She felt healthy, walked every day, and had never broken a bone. But one simple scan, a bone density test, almost destroyed her quality of life. Within weeks of starting the medication it led to, she developed painful reflux, jaw pain, and even stopped playing the piano she loved. And she's not alone. Every year, millions of seniors over 70 are pushed into tests and treatments they don't need. Here's the truth. Most doctors never say out loud. Past the age of 70, some of the most common checkups can do more harm than good. Research shows that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or side effects that never needed to happen. Even more shocking, almost every senior past 70 is being over-tested without realizing it, and one of these routine checkups, the one at the very top of our list, is now linked to 5% of all cancers in the United States. That's the same risk as drinking alcohol every single day. This isn't fear-mongering, it's what the science says. And today we are going to uncover it together. The 5 health checkups you should avoid after 70 and the hidden dangers that can quietly steal your health. Stay tuned, because number 2 on this list is even more shocking than number 1. Before we begin, I'd love for you to comment below where you're watching from, your age, and whether you've ever regretted a test or procedure. Do you think seniors are tested too much? We read and reply to every comment, and your story might help another senior watching today. And don't forget to like this video and subscribe for more advice like this. Now, let's start with the first test, bone density scans, also known as DEXA scans. On the surface, they look completely harmless. No pain, no needles, and you walk away with a report showing how strong your bones are. But here's the hidden problem. After 70, the results almost always show bone loss, even when there's no real danger. That's because bone thinning is a normal part of aging, just like wrinkles or gray hair. But instead of reassurance, seniors are often placed on powerful drugs like bisphosphonates. These medications can cause severe side effects, jawbone necrosis, esophageal irritation, and lifelong digestive problems, with very little actual benefit. In fact, a major study following over 1,200 women above 70 found that bisphosphonates reduced fracture risk by less than 0.5% over 5 years. That's almost nothing. Meanwhile, the side effects can be devastating. Remember Rose? Once we stopped her medication and focused on lifestyle changes, vitamin D, calcium-rich foods like sardines and leafy greens, and resistance-band exercises, she regained her strength, balance, and went back to performing music within a year. No fractures, no fear, no unnecessary drugs. The science is clear. For seniors over 70 who haven't experienced falls or fractures, lifestyle is the safer and more effective option. In fact, a 2022 osteoporosis international study found that strength training, proper nutrition, and treating vitamin D deficiency reduced fracture risk by more than 20%. That's a massive improvement compared to the near-zero benefit of medication. Don't let a number on a screen scare you into a treatment that could take away your quality of life. But what if I told you there is another scan, one that doesn't just cause fear, but could push you into brain surgery you didn't even need? That's the next test on our list. Number 4, the brain MRI for memory loss. When seniors start to notice forgetfulness, it's natural to fear the worst, dementia or Alzheimer's. And many doctors quickly respond by ordering a brain MRI. On paper, it sounds like the smart choice, a detailed image of the brain that might reveal the cause. But here's the uncomfortable truth. In people over 70, most MRIs don't provide helpful answers. What they usually show are age-related changes, mild shrinkage, tiny white spots, all of which are normal in older adults. The danger is what happens next. Once those spots appear on a scan, they can trigger a chain reaction, fear, additional testing, and sometimes even invasive procedures that bring more harm than clarity. A 2021 study published in Neurology Today analyzed more than 3,000 seniors aged 70 to 85 with mild memory complaints. 86% had some abnormal finding, yet only 3% were linked to a treatable problem. That means 97% were told something looked wrong when really it wasn't. Even worse, nearly 12% went through spinal taps or brain biopsies, all because of vague MRI results. Take George, a 74-year-old retired engineer. He was sharp, but he misplaced his keys more often and occasionally forgot names. His doctor ordered an MRI which showed common white matter changes. George panicked. Convinced he had dementia, he stopped driving, stopped going to church, and isolated himself. But when we tested him with a simple cognitive exam, his score was completely normal. With reassurance and lifestyle changes, better sleep, hydration, and brain exercises, his memory stabilized within months. The truth is this: unless you're experiencing severe neurological symptoms such as seizures, sudden personality changes, or a rapid decline in daily function, a brain MRI is rarely useful. A far better first step is a cognitive screening test, a quick, low-cost, paper-based exam that evaluates memory and problem-solving. It avoids unnecessary panic, avoids invasive follow-ups, and gives a more accurate picture of everyday brain health. Now let's move to number 3, the cardiac stress test. It's one of the most common exams ordered for seniors with vague symptoms like fatigue, mild chest tightness, or simply feeling slower than before. A stress test involves monitoring your heart on a treadmill or through medication that simulates exercise with the goal of finding blocked arteries. But after 70, the accuracy of this test drops dramatically. False positives, results that suggest heart disease when there isn't any, can reach as high as 40%. And what follows those false alarms? Angiograms, stents, even bypass surgeries that often do not improve survival or quality of life. In fact, a 2017 study in JAMA Cardiology showed that more than half of stents placed after stress test referrals were done in patients who had no symptoms and gained no real benefit. What they did gain were complications: bleeding, kidney injury from contrast dyes, and longer hospital stays. This is exactly what happened to Raymond, a 75-year-old retired mailman. During a checkup, he mentioned occasional tiredness on hills. His doctor ordered a stress test. The results were unclear, so he was sent for a catheterization. Doctors found a mild narrowing and placed a stent. That night, he reacted badly to the contrast dye and developed kidney problems, spending 6 days in the hospital. His fatigue never improved because the issue wasn't his heart at all. He just needed better hydration and pacing himself during activity. If you're over 70 and not experiencing classic cardiac symptoms, chest pain with exertion, shortness of breath, or sudden energy loss during light activity, a stress test may do more harm than good. Safer options include a resting EKG, which looks at your heart rhythm while still, or a coronary calcium scan, which shows plaque buildup with much less risk. And that brings us to number 2, one of the most surprising items on this list, a test many seniors have had more than once, and one that carries serious risks after 70, the colonoscopy. Number 2, the colonoscopy. By the time someone reaches their 70s, most have either had this test or been strongly encouraged to do it again. Colonoscopy is designed to look for polyps or cancer in the large intestine. And in younger people, say between 50 and 60, it has real value. But after 70, the equation shifts. The same test that might once have saved a life can now introduce risks that are greater than the benefits. The first problem is the preparation. You're asked to drink liters of strong laxatives the night before. For younger adults, it's miserable. For seniors, it can be dangerous. The sudden loss of fluids can cause dizziness, fainting, and dangerous dehydration. For those with kidney disease, and nearly half of adults over 70 have some level of kidney impairment, the stress of the prep alone can cause kidney failure. Emergency rooms see thousands of older adults each year, not from the procedure itself, but from the preparation. Then there's the sedation. The medications used to keep you comfortable can linger in the body much longer as we age. The result? hours or even days of brain fog, confusion, and higher risk of falls. For someone already unsteady on their feet, this can mean a hip fracture, which is often far more life-threatening than the colon cancer the test was supposed to detect. The procedure itself carries risks, too. There can be bleeding, infections, or tears in the bowel. A 2019 study in JAMA Internal Medicine looked at over 1.3 million seniors on Medicare. It found that for every 1,000 colonoscopies performed in people over 75, only 2 lives were saved, but more than 20 people experienced serious complications. That is a 10-to-1 ratio of harm to benefit. Dana, age 73, experienced this firsthand. She was a healthy grandmother, busy running a bakery with her daughter. With no symptoms and no family history, her doctor still urged her to repeat the test. A tiny polyp was removed, but later that night she collapsed in pain. She had suffered a bowel perforation, was hospitalized for 9 days, and lost her strength for months. The tragedy? Her 2 previous colonoscopies had already been clear. She never needed the 3rd one. And Dana is not alone. Harold, 78, had mild diabetes and kidney problems. He attempted the prep, became severely dehydrated, and ended up in the hospital before the test even happened. His colonoscopy was canceled, but the damage from the prep alone left him weaker than before. Another patient, Louise, 80, had her procedure go perfectly well, but afterward experienced weeks of confusion from the sedative drugs. She fell twice at home, breaking her wrist on the 2nd fall. So what are the safer alternatives? For most people over 70, the FIT test, a fecal immunochemical test, offers nearly the same cancer detection rate without the invasive risks. It's done at home, no prep required, and no sedation. Stool DNA tests like Cologuard provide another option, picking up many cancers without putting the patient through the ordeal of colonoscopy. And remember, guidelines now recommend stopping routine colonoscopies at age 75 unless there are specific symptoms such as bleeding or unexplained weight loss. Now, let's move to number 1, the full-body CT scan. This is often sold as peace of mind in private clinics or as part of executive health packages. But for seniors, it can be one of the most harmful choices you can make. Why? Radiation. Each full-body CT scan delivers as much radiation as about 500 chest X-rays. That's a massive dose. And a 2023 modeling study in JAMA Internal Medicine estimated that unnecessary CT scans may now account for up to 5% of all cancers in the United States. That's 1 out of every 20 cancer cases, caused not by lifestyle or genetics, but by the very tests meant to detect them. The second problem is what doctors call incidentalomas, incidental findings. These are harmless little spots, nodules, or cysts that show up on the scan. They're a normal part of aging, but once they're spotted, they create fear, and that fear drives more testing, biopsies, even surgeries. Marcus, age 80, found this out the hard way. He was still teaching martial arts to younger seniors when he signed up for a full-body scan. Doctors found a tiny lung nodule. He was referred for a PET scan, then a biopsy. The result? Benign. But the biopsy collapsed part of his lung. He was hospitalized for weeks and never fully regained his stamina. Linda, a 72-year-old church volunteer, had a similar story. Her employer offered free full-body scans as part of an insurance perk. Her scan showed a small cyst on her kidney. For years afterward, she underwent repeated ultrasounds and follow-ups, always anxious that it might be cancer. Eventually, it was proven harmless, but the stress had already taken its toll on her mental health. She told us, "The test didn't save my life. It stole years of my peace of mind." This is why experts, including the American College of Radiology, strongly advise against full-body CT scans in people without symptoms. They simply don't save lives. Instead, they create false alarms, extra costs, radiation damage, and emotional distress. If you have symptoms like coughing up blood, dramatic weight loss, or unexplained swelling, then targeted imaging makes sense. But scanning your entire body, just to be safe, is like searching for treasure in a minefield. You might find something, but the price of digging it up could be devastating. So let's bring this together. 5 common health checkups that may look protective but can actually harm seniors over 70. Bone density scans, brain MRIs, cardiac stress tests, colonoscopies, and full-body CT scans. The lesson is not to ignore doctors, but to ask the right questions. Always ask, if this test finds something, how will it change my treatment? What is the risk of harm compared to the chance of benefit? And do I truly need it at my age and health status? Real prevention doesn't come from endless testing. It comes from lifestyle, staying active with regular strength and balance exercises, fueling your body with nutrient-rich foods, protecting your sleep, and caring for your mental health will protect you far more than a scan ever could. Medicine is powerful, but after 70, less is often more. Now we'd love to hear from you. Have you or someone you love ever gone through a test that turned out unnecessary or even harmful? What happened? Share your story in the comments. It may help another senior avoid the same mistake. And if this video gave you new insights, please like it, subscribe for more trusted health advice, and share it with a friend. Together, we can make aging stronger, safer, and wiser.